In need of health insurance? Great news. The deadline to get yourself covered has been extended until August. What if you're 65 years old? Well, it's time for Medicare, but maybe you need help taking care of that. We have experts to help you navigate the process. Catherine Sevier is with AARP of North Carolina. Morgan Campbell is with Alliance Insurance Services, and Laura Packard is with Get America Covered. They're all here to answer your questions. We've got 3 experts, so we're going to be able to answer your questions on healthcare. If you have a question, the way you get it to one of these experts is to text us 336-379-5775. Remember, this is text only, so please do not call. All right, first and foremost, our very first question, Laura, this one's for you. It says, what is the deadline to enroll in the ACA plan?
The new deadline is August 15th, but there's no reason to wait. The new numbers are already on healthcare.gov, so you can go there today and find out how much you'll save.
Okay, and so one of the ways to do that is to go to ACA, right, .gov, be able to look at all of the plans, and that may just make you want to go, oh no, this is like way too confusing. So if that is the case, that is where Morgan comes in. She is an independent insurance agent. That doesn't mean that she gets the money for signing you up. So we want to make sure that you know that it is a free service. But Morgan, how does an insurance agent help?
So what we can do is look at the plan, we can look at the network, we can look at the medications that are in each plan's formulary and figure out what plan is best going to fit your needs. If your physician is with Novant, then you're not going to want to select a plan that is just with a network of only Wake Forest Baptist, because you're going to have to give up your primary care physician and you're not going to be happy and you're not going to have a pleasant experience with that.
All right, and sometimes you just need a little bit of help in figuring out what is the best plan for you and your family, so don't be afraid to be able to do that. All right, speaking of which, don't be afraid to ask questions. Catherine, we're going to put you on the spot now because everybody always asks the question, I'm turning 65, do I really have to apply for Medicare?
Absolutely, and you have to do it within the window that we give you, which is 3 months before your 65th birthday, the month of your birthday, and 3 months after. If you miss that deadline, you're at risk for having to pay a premium forever afterwards. So you want to go on, you want to sign up. And if you're still working and you have an employer, you need to go and talk with your benefits folks, because there are a lot of criteria for what you could do during that period if you wanted to think about keeping your other insurance. So absolutely, just see that as a red letter day for you.
Absolutely, sign up. Okay, so the next question, Laura, this person is asking, if I enrolled before August 15th, will I need to re-enroll next year?
Yes, the normal open enrollment period is November 1st to December 15th for next year. And we don't know yet if the administration is going to change that period at all, but at least for now, it's November 1st to December 15th. So if you're enrolling now, it's for this year. And at the end of the year, you'll need to enroll again.
Okay. Morgan, this person is asking, what if I plan to move to a different state in 2 months? Do I have to re-enroll?
So that's a very easy process. If you have an account on healthcare.gov, you simply go in, report a life change. There you're going to change your address, and the system is automatically going to pick that up. And when you get to the end of your application and have your eligibility notice at the end, then you're going to be able to select plans that are available in that state.
Oh, okay. So then you'll be able to know already which one you want to do. All right, smart.
Correct.
All right, Catherine, this person is asking, do most people drop their regular insurance once they're enrolled in Medicare?
I think most people drop their health care insurance if they have an employer, or many of them do, but they look for a Medigap plan to pay for the balance between what Medicare covers and what the true cost of their care is. So again, it's just so important that you, if you're working, look at whether or not that insurance is better left intact or becomes your Medigap insurance.
Mm-hmm. And there is no harm in asking 1,000,001 questions to everyone about this.
No, and when you go on the Social Security website, you can read all of that, and then you'll have 1,000,001 more questions. So get help rather than guess.
And AARP can help with that?
AARP, if you go to www.aarp.org/Medicare, there's a lot of just basic information there that helps you to learn the vocabulary and figure out what's going on.
Okay. All right, we're going to continue to take your text questions. We've got one more segment coming up. This is how you get those questions to these experts, 336-379-5775. We'll be right back.
Want your question answered? You've got to send a text message. Take out your cell phone and type out your question. Then send it to 336-379-5775. Don't call. You must send a text message if you want your question answered.
Welcome back. We are taking your questions about ACA, Marketplace, healthcare enrollment, as well as Medicare. All right, Laura, this person is asking, how many options do you have when enrolling in ACA?
It really depends on your county. There could be a whole bunch, and so you'll have to go to healthcare.gov to find out.
Okay, and it does change from county to county, so be aware of that. Morgan, this person is saying, how does the pricing for the ACA plan compare to a health plan for a job? And you can't really take a Marketplace insurance if you have job insurance.
Correct. So that's really an apples to oranges situation. The only way that you could take a ACA plan is if your employer did not allow your dependents to come on to the plan, and then your dependents would qualify for a tax credit, or if you were paying out more than 8.5% of your household income, and then you could possibly get by with taking that tax credit based off the affordability of it.
Okay, but that is not the norm there, so just know that.
Not the norm.
Catherine, this person says, my mom has TRICARE insurance. Does she still have to keep Part B Medicare?
Yes. TRICARE does not cover you if you do not have Part B. It is actually your supplemental in that situation.
Mm-hmm. And kind of a follow-up here, I was told if I have employer coverage, I don't need to sign up for Medicare. Is that correct?
No, that is not correct. You may choose not to, but you must waive your Medicare during that time while you're still employed, but you have to interact with Medicare sometime during that window that we talked about, 3 months before, 3 months after the month of your birthday.
Okay, but you waive Part B, but you need to sign up, otherwise the penalties happen. All right. Morgan, this person is asking, I'm no longer with my old employer, and I need to know how long does my insurance continue before I have to enroll in new insurance. How do I find that out?
Well, depending on the size of the employer, you may be offered state continuation, or you may be offered COBRA. If you explore those two options, your employer is automatically going to send you that notice by mail. If it's too much for you to pay, or if you try to contact your HR department to see if you can get your COBRA premiums paid by the American Rescue Plan, that's an option. Or you could go to healthcare.gov and pick up a plan there with a tax credit. So you've got several options in that situation.
Okay. Laura, this person's asking, I'm under 65 and unemployed. Do I have to have health care? Do I have to enroll?
Well, there's no mandate anymore, so you don't have to, but you should definitely check out healthcare.gov if you've lost your job. If you haven't been long-term unemployed, you may be eligible for a cheaper free plan through healthcare.gov because of the American Rescue Plan. So go there and check it out before you write it off.
All right, Catherine, this person's asking, when enrolling in Medicare, do I also enroll in Medicaid?
No, the two things are not the same. You may be eligible for Medicaid, and in that situation, you really need to work with the Medicare and Social Security enrollment to see if you're eligible to apply, but those are two different applications.
Okay, the ACA enrollment goes now until August the 15th. There are numerous different kinds of healthcare options for you. And so one of the options that you have, of course, is to look at it on your own. Another option is to go to an insurance agent. And Morgan, we were just talking during the break how some insurance agents, now they're not supposed to charge you for doing this. So some insurance agents have said, oh, we have to give you this fee. If someone is having that conversation with an insurance agent and that insurance agent says, we need to charge you a fee, what do you suggest those people do?
I would call another agent that doesn't charge a fee.
And ask up front.
Ask up front. If they have an application fee, they legally have to have it posted and they have to make you aware of that ahead of time. But once again, we are all paid commissions by the insurance carrier. There is no reason for you to pay an application fee.
This is good to know. This is an interesting question. I washed my husband's Medicare card. How do I get a replacement?
Go online and there's a way to apply for it there, and they will send you another one, or they will give you an ability to print it online.
Okay, so online. And this person says, I understand that you have to re-enroll in Medicare after the first partial year, but do you have to re-enroll every year?
No, you do not. You are always, unless you decide during the open season that you want to look at another or a different Medicare plan, like an Advantage plan. But otherwise, your Medicare continues on.
Okay, and one quick thing again, Laura, the enrollment period goes until?
August 15th.
And that is for this year, and people will probably have to re-enroll again starting in November for next year. All right, we want to make sure that that's very clear for folks. I know we can't say it enough. Thank you, ladies, for your expertise and your time. We appreciate it. They will be joining us again for sure as we get closer to that enrollment date. If you missed any of this, the information is on our website along with resources for you so that you can find out more about Medicare, Medicaid, and also ACA enrollment.